Hello everyone. So in this video I'm going to talk about the bronchopulmonary segments. Okay, it's an IMP question which is generally asked into the exam many times. So let's see. So here bronchopulmonary segment. So pulmonary, that means lung. Okay, and generally lung which is made by segments. So that's why the segments is known as the bronchopulmonary segments. Now we see what is BPS. Let's see. So these are well-defined anatomical, functional and surgical sectors of the lung. BPS, that means short form of bronchopulmonary segments. Okay, so it is the well-defined anatomical, functional and the surgical sectors of the lung. For understanding of the bronchopulmonary segment, first of all we clear about the anatomy of lung. Okay, so let's see. So here I am just write down a bronchopulmonary segments as seen on costal surface. Okay, and other I'll say bronchopulmonary segment is seen on mediastinal surface. Okay, generally in costal surface the 7-number segment is not seen. Okay, here see 1 2 3 4 5 6 8 9 10. 7 number is not seen. Here also 1 2 3 4 5 6 8 9 10. 7 is not seen. So the generally in costal surface the 7-number segment is not seen. And in mediastinal surface, see here it is a mediastinal surface diagram. Okay, the bronchopulmonary segment seen on the mediastinal surface of left and right lungs. So it's a left lung and here it's a right lung. So 1 2 3 4 5 6 7 8 9 10. Left lung, so all the segments, but in right lung the 4-number segment is absent, or we can say not seen into the mediastinal surface. 1 2 3 5 6 7 8 9 10. Okay, so first of all we study about the what is costal surface and what is mediastinal surface. So first, costal surface of the lung. So lung surface which is covered by ribs. Okay, generally costal means क्या होगा? Ribs. So lung surface which is covered by ribs, that known as the costal surface of the lung. Second, mediastinal surface. So surface direction towards the heart, or we can say the surface direction towards the mediastinum. Okay, so that is known as the mediastinal surface. The root of the lung present in mediastinal surface, from where the bronchioles and blood vessels enter into the lung. Means the root of lung, okay, that present into the mediastinal surface, and from where the bronchioles and the blood vessels which is enter into the lung. Okay, so remember this point. Now we see about the diagram. Okay, so here the segments is shown on into the costal surface. Okay, now I'm just draw a easy diagram for understanding the segment easily and draw into the exams. Okay, so here I draw a right lung. Now I make a left lung. Okay, so how you know it's right or it's left lung? So from lingula. Okay, here its lingula is present and it's a cardiac notch. Okay, it is called as cardiac notch. Okay, so here it is a right lung. We write here right lung and it's a left lung. Okay, now we draw a fissure. In right lung generally 2 fissures are present, but in left lung generally only 1 fissure are present. Okay, so here we draw a oblique fissure and it's a horizontal fissure. Okay, but in left lung only oblique fissure is present. Okay, so oblique fissure is present. So the right lung is divided into 3 lobes: upper lobe, middle lobe, lower lobe. It's upper lobe, middle lobe and lower lobe. Okay, but the left lung is divided into only 2 lobes, the upper lobe and the lower lobe. Understand? So right lung has 3 lobes and left lung has 2 lobes. Right lung has 2 fissures but left lung has only 1 fissure. Now we draw segments. Okay, so first of all in right lung you have to draw in exam a 1 oblique fissure and 1 horizontal fissure. Then you have to just simply make a Y here, Y shape. Okay, then here to make about capital A. Okay, or you just simply draw a 1 line. So Y and A we make. Okay, then we here draw a pie shape. Pie shape which generally we use in maths exam. Okay, remember. So here we just simply made a pie shape. So our segment is ready. 1 2 3 4 5 6 7 8 9. Okay, 9 because 7 number is not seen. Then we talk about left. So in left we just firstly draw a A. Okay, here we make a A. Then here we make a Y mirror image, Y. Then here we make a pie shape again. Okay, so our right and left lung segments is ready. Now we give a number. Okay, so here 1, 2, 3, 4, 5, 6, 7 is not. Okay. 8, 9 and 10. Here we see 1, 2, 3, 4, 5, 6, 7 is not, 8, 9 and 10. So numbering onto the costal surface of the lung is ready. Okay, you have to practice this so you also make it easy in exam. Okay, now here the bronchopulmonary segment seen on the mediastinal surface of left and right lung. See here, it's root of the lung, and here 10 segment is present on left lung, but right lung only 9 segment because 4 number is not seen. So how to draw mediastinal surface? Okay, let's see. So here I make a left lung, okay, and here a right lung because it's a mediastinal surface. So right lung here and left lung here. Okay, now simply you draw a root of the lung, Okay, then for left lung you have to make a one Y shape here first, Y. Okay, then you have to draw 8 lines. 1, 2, 3, 4, 5, 6, 7, 8. Here also we make a one triangle for right lung, and then we draw 8 lines. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Now we give a numbering. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here 1, 2, 3, 4 is not seen. Okay, I told before. 3, 4. Okay, then 5, 6, 7, 8, 9 and 10. So our numbering is ready. Okay, so it's a diagram of the mediastinal surface. Okay, remember number 4 is not seen onto the right side. Now we see about the names of the bronchopulmonary segments. Okay, so here right lung and left lung. So I told right lung has 3 lobe, upper lobe, middle lobe and lower lobe. Left lung has 2 lobe, upper and lower only. So first see right lung. Upper lobe had 3 segments, apical segment, posterior and anterior. Middle lobe has lateral segment and medial segment. And the lower lobe has superior, medial basal, anterior basal, lateral basal and posterior basal segments. Names. Now the left lung bronchopulmonary segment names is, so the upper lobe is further divided into 2 divisions, upper and lower. Okay, so it has 3 segments here and 2 segments here. So in upper division, apical segment, anterior and posterior. In upper lobe lower division, 2 segments present, superior lingual and inferior lingual. In lower lobe, total 5, same like here. Okay, superior, medial basal, anterior basal, lateral basal and posterior basal. Only different is here a lingua, because in left lung lingula is present, in right lung it is not present. So that's why it has a 2 other division, that is superior lingual and inferior lingual. Thank you. The next session of the bronchopulmonary segment we see into the next video. Thank you.